My name's Robert Thornsberry. I'm one of the partners here at OrthoGeorgia. I've been here 30 years now, and so I've had a lot of experience, and we're going to talk a little bit today about non-operative orthopedics. So everybody thinks they're coming to the orthopedist and they're coming to see an orthopedic surgeon. Well, yes, we here are all surgeons, but most of what we do is non-operative. There's very few people that come in here that we immediately operate on. We've got a lot of options and a lot of different things that we can do in regard to non-operative orthopedics. Not everybody gets surgery. We did a little thing last year studying one of our spine surgeons, and he operated on 1 out of 100 people that he saw. So he's a busy orthopedic spine surgeon, but he's only operating on about 1 or 2 out of 100 people that he sees. I think in my practice, I operate, and this is new patients, this is not even considering patients I've been treating for forever, but even my new patients, only about 1 in 8 are even suggested to have an operation. So there are a lot of non-operative orthopedics that goes on here. And if you come to our parking lot, you can see it because there's a lot of cars out there and not all those people are getting operated on. Some of the options that we have whenever you come to OrthoGeorgia and get evaluated, and that's the first thing, you need to get evaluated, you need a diagnosis, and you need to have options to treat that diagnosis. So for example, with what I deal with a lot is knee arthritis. Well, if you come in, we need to evaluate you, and then we need to see how bad your arthritis is with various modalities, x-ray or an MRI if it's indicated. But we would make a decision based on that, what's best for you. And again, most of the time it's not surgery, or at least it's not surgery right away. One of the old things that we say in orthopedics is we don't treat x-rays. So you can have some of the worst x-rays in the world, but it doesn't mean you have to go run, have a knee replacement. And we don't take surgery lightly. So when we make these, give you your options, it's with good, sound understanding. There are a lot of places now that have popped up called regenerative orthopedics and different types of things where they act like they're going to build a new knee out of what you already have, and there's no proof or anything that any of that works. There are various options that we have that we can treat non-operatively. Number one, if you get a good diagnosis, we can give you anti-inflammatory medications or other medications which may benefit you. We have all types of injections that we do here in the office that can benefit you, all the way up from things that are tried and true, such as cortisone, all the way up to newer things which are restorative in some extent, in that they are cut the inflammation, increase pain, things such as platelet-rich plasma and some stem cells. We do all of these things that are advertised. That's not, there again, not our first option. We have other options that we can do before that. And some things don't even include a needle. We do physical therapy. A lot of people can get better with therapy, especially back, neck, shoulder problems, and a lot of hip problems can get better just doing therapy. Knee problems can get better doing therapy. There are just a multitude of things that can be done. Bracing, we have different braces. We have a whole brace shop here, and there's different braces that you can wear, which will benefit you and hopefully keep you away from surgery. Having said all that, one of the things that I try to tell patients all the time is be patient. Your body will heal, and when you get hurt, you get a diagnosis, listen and do what the physician guides you to do. And most of the time, the body heals itself. We don't have to do anything, and let's just wait for time, because the body and God will heal you, and that's the greatest healer. The other things that we can do from a point of view of non-operative things are, we have various exercise programs that you can do at home in addition to the therapy. We have various, again, the medications. There are some newer medications that may help, but there again, they're not mainstay right now in the treatment regimen. One thing I wanted to talk about a little bit and I brought it up a minute ago, is the use of what are called regenerative orthopedics or biologics. And biologics are human tissue or your own tissue which can help joints to heal. The ones that are being used most commonly are platelet-rich plasma, where we take blood from you, we spin it down in a high-speed centrifuge, and then we get the good stuff on the top, which is the platelet-rich plasma. It does have anti-inflammatory properties, and it probably has some type of healing properties. There again, it's got some of the good nutrients which can for lack of a better term, bathe your joint and help it to heal. That has been proven to work in knees and somewhat in tennis elbow, but there again, it's invasive a little bit, but it's not like having surgery. The other one is having stem cells, and there's two types of stem cells that you can use. There are from your bone marrow, so you can harvest it from your bone marrow, or you can harvest it actually from fat cells, and we do a mini liposuction that gets fat cells, and that actually has more stem cells than the bone marrow. And then you purify those, and we put those in the joint. None of that is covered, neither of those is covered by insurances, but they are an alternative. And there again, they're not the first alternative. They're on down the line, and they're not totally proven. The platelet-rich plasma does have good data for knee arthritis, but the stem cells in most of the studies that are truly good studies, that are double-blinded studies, don't show a huge difference. So we don't do that quite as often. But in conclusion, what I think I want to get across is that most of what we do here is not operative orthopedics. Most of what we do is non-operative orthopedics, and we have a multitude of avenues that you can go down that can get your joints better and get your muscles better without surgery. If you've got joint pain, muscle pain, musculoskeletal pain in general, don't be scared. You're not going to come here and get operated on. We do a lot of surgery, and we are proud of how we do it. But having said that, most of what we do is non-operative, and if you have musculoskeletal pain, please call us here at OrthoGeorgia, and we'll be happy to help you take care of it.